Naomi Lopez is the Director of Healthcare Policy at the Goldwater Institute, and she's a passionate advocate for liberty and healthcare innovation. And we were fortunate to have her author a chapter in our book entitled Unleash Technology, Maximize Telehealth's Potential. Naomi, you provide a really compelling story of Claudia and her daughter and how they benefited from telehealth over the last several years. Can you walk us through that story?
Before COVID, Claudia was driving her disabled daughter across the desert 3 hours each way, twice a week, so that her daughter could get the specialized care that she needs. During the pandemic, because of the rules that were relaxed, she was able to have her daughter's visits done through telehealth, either through a smartphone or a computer from the comfort of their own home. And now she only has to go to Phoenix and make that trip about once a month. But her daughter is still getting the highest quality care and has access to those specialists that have been caring for her all along, really demonstrating that telehealth does make it possible to provide better access and care to those patients when they need it, where they need it, and in the manner that best suits them.
You know, there's patients like Claudia all over the country that are going to benefit from telehealth. And states, like you mentioned, took a lot of steps during the pandemic to loosen the rules that allow patients to better access healthcare services. You talk specifically, and you mentioned it, about Arizona. Can you talk about how Arizona reformed their rules in this area and can really be a template for other states to expand healthcare access?
Arizona took a really important step forward in terms of removing a lot of the barriers and obstacles that stand in the way to telehealth, both directly to the patient and to hospitals and other medical institutions and facilities. For example, providers across the country who are in good standing can register with the state of Arizona and provide services and care to patients within the state. We also have the ability now for hospitals in the state of Arizona to more easily access specialists from around the country that can provide dedicated, highly skilled, highly expert services and care to patients in Arizona, especially to those facilities that may not be able to attract and recruit that level of talent on a full-time basis. They can now obtain those services when they have a patient that specifically needs them. We will have, I think, higher quality care to more people ultimately.
Naomi, thanks so much for your important work on this chapter.